Hello, everyone. Today, I want to talk about something a lot of people deal with, especially as they get older. But honestly, it can affect anyone, and that's arthritis. Now, you've probably heard people say things like, oh, that's just old age, or I'm just a little stiff today. But sometimes what you're actually feeling is arthritis. And the good news is, once you understand what's going on in your body, there are simple things you can do to manage it and that can actually help you feel better. So let's break it down in simple terms. What is arthritis? Arthritis simply means inflammation of the joints. Your joints are the places where two bones meet, like your knees, your hips, your hands, your shoulders, and they're designed to move smoothly. But when arthritis sets in, that smooth movement can turn into pain, stiffness, and sometimes limited movement. Now, there are a few different types, but the most common two you'll hear about are osteoarthritis. This is more of a wear and tear over time, or rheumatoid arthritis. This is an autoimmune condition where the body actually starts attacking your joints. Both cause pain, but for different reasons. Now, let me also say this there are certain things that can increase your chances of developing arthritis. For example, aging, just getting older, joint overuse after an injury, obesity, yes, which puts more pressure on the joints, especially the knees, and even being a female, because some types of arthritis are more common in women. So, if any of those apply to you, it just means you want to be a little more intentional about protecting your joints. Now, let's talk about how you may feel. Some common symptoms include joint pain, stiffness, especially in the morning, swelling, limited movement, warmth or tenderness around the joint. And for some people, it shows up first thing in the morning. For others, it's after they've been active. You might notice things like your knees feel tight when you first get out of bed, or your hands feel stiff when you're trying to grip onto something like the door, or your joints just don't move as easily as they used to. And that's your body trying to tell you something. Now, let's talk about what you can actually do, because this is the part that gives you some control. Managing arthritis really comes from daily habits, but also knowing what support options are available to you. First, keep moving, but don't overdo it. Exercising frequently, gently, and consistently actually helps your joints stay flexible. Things like walking, stretching, light exercises such as swimming. Movement is medicine when it's done the right way. Next, you can use heat and cold. Heat helps relax stiff joints, and cold helps bring down swelling and inflammation. Another big one is weight loss if needed. Even a small amount of weight loss can take pressure off your joints, especially your knees and hips, and reduce the pain over time. And don't overlook this wearing supportive, well cushioned shoes can reduce stress on your joints and improve how you walk and move throughout the day. Now, in addition to lifestyle changes, there are also some treatment options depending on how severe your symptoms are. That can include pain relief medications to help manage discomfort, over the counter, such as acetaminophen or ibuprofen, if your provider approves. So always consult your medical provider first. Also, physical therapy, which your medical provider would be the one to order it, assess you for it, and order. Um, this helps strengthen the muscles around your joints and improve your mobility. And in more advanced cases, joint replacement surgery, especially for hips and knees when the joints are severely damaged. Also, implementing an anti inflammatory diet, which is mostly fruits and vegetables, healthy fats like fish and olive oil, whole foods like eggs, beans, and even potatoes. Try to limit processed foods, excessive sugar, and fried foods because these can increase inflammation in your body. Now, most joint pain can be managed at home, but there are times you have to see a provider. Pay attention if the pain lasts for weeks, or the swelling doesn't go away, or your joints are getting harder to move consistently, or it started to affect your daily activities, such as cooking, cleaning, running errands, or if you notice changes in the shape of your joints. Don't ignore those signs. And if you think it could be something more like rheumatoid arthritis, you can talk to your medical provider about getting the necessary blood work done because autoimmune arthritis is a little more serious and needs a different type of treatment plan. But here's what I want to leave you with. Arthritis can be frustrating, but it doesn't mean your quality of life is over. A lot of people live well with arthritis by making small, consistent changes. It's not about being perfect, it's about being intentional with your body. And I love this reminder, Isaiah 40 and 29. He gives strength to the weary and increases the power of the weak. So even in the days when your body feels tired, stiff, or worn down, there is still strength available to you. If this video has helped you, go ahead and drop a comment. Share this with someone who may be dealing with joint pain. And don't forget to like, share, and subscribe.